So that's a perfect segue into what we're here to talk about, if I'm not mistaken. So welcome everyone. It's just a couple minutes after 12. And I'm Daniel Stein. I'm the one of the co-founders of Stewards of Change. And I'm really delighted to be here today. I want to announce this is our 51st webinar over the last year. So it's a fitting moment, time to bring all that stuff together. And a lot of the thoughts and ideas and people who've been contributing to this ongoing conversation are poised and ready to move to the next level. And that's what it's all about, synthesizing and figuring out what we're going to go do next. And that conversation is the crux of what we're calling here the National Action Agenda to advance upstream social determinants of rights equity. You couldn't put too many more words in that title, but I'm not sure there's an acronym that works either. So I have, there's a lot of folks on the call here, but our three colleagues who are really co-stewarding this, Dr. Karen Smith is with us, former head of Department of Public Health in California, PG Forest, University of Calgary, and prior I met PG at Hopkins years ago. And David Reckhoff from Stanford and a number of other colleagues. So we're hosting this year's event, or next year's event, hopefully, potentially the first in-person event in California. That's the goal, in March of next year. And so they're the co-PIs, I might say, at least helping shepherd and guide the direction of this. So we're going to just launch into today's efforts here. And I think let me see if I can advance my slide. There we go. So we have a chat box, of course, and we'll be monitoring. There'll be some information coming at you, different URLs to participate, and different things that we've been doing that might be relevant. And Gillian is covering that today. And then we'll, of course, we have some time reserved at the end for conversation, but we want to really lay out the game plan, because there's been a lot of work to kind of set the chart between now and March of 2021. And so the agenda for today is really to do a quick overview, just to level set. And then the question at hand is why now? You know, we have to set the context for what we're actually asking, what we're planning to do, what we're hoping to do, what we are doing, and where we want to be going. And that leads into the next section, which is the action agenda components. What are the actual things that are happening between now and then, and what's going to come out of that, and specifically how you, your colleagues, your organization may or may not want to be involved, to what degree, to help set the agenda and to shape the agenda going forward, because this is an agile process. We're developing it as we go forward. In fact, it reminds me when we were at Hopkins, Stephanie Reel, who was one of the vice presidents at Hopkins, as we were planning one of our events, said, you know, I've given up on the field of dreams approach to life. We have to build it together as we go, so that when we arrive, we'll be there. It's kind of Zen in a way, but it's a very powerful thought that I've always tried to aspire to, which is to bring the community along. And that's really what today is about, is to say, okay, we're going to go do stuff over the next 9 months, come on board. And because we're a collection of collaboratives, I'm hopeful. So we'll talk about next steps and what that's going to look like. So if you have questions, put it in the chat. I'm not going to stop too much for a couple minutes because we're tightly choreographed today. So if you want to add thoughts or questions, of course, we're going to post all this stuff. This is being recorded. It's being live streamed, and we'll put it up on the National Interoperability Collaborative Hub. There's a slide at the end for that. You'll see the connections. You can pull down the video and all the other 50 videos and binge watch them this weekend, if you so choose. Get up to speed, and we have a place for communication, so people can actually talk to each other, become members, and do some of the work. That's where we'll actually be housing the work as we go forward. There's a home for it. There's a lot of content and a lot of community built into the foundation, which I have to thank the Kresge Foundation. There you go. Who's been our amazing partner for the last 3.5 years. They saw the opportunity that they could pronounce interoperability, although there was a lot of conversations with the CEO Sterling and David Fukuzawa, who's our program officer, and Raquel, who joined the foundation, to really convince them that the way they needed to fulfill their mission which was really cross-sector, was to fund stuff cross-sector. And so they were the first foundation in the country, I think, to say we got to put health and social human services together in a funding portfolio. Otherwise, we just continue to fragment the work we're doing more. So they have they've been on a couple of year journey with health equity at the center of it, and driving us and challenging us to think about that for the last couple of years, which is also good preparation for today and where we are with what we have to deal with. So thanks to them, we've had the opportunity to build a platform, to build an infrastructure, to build a community that is there, right, ready to go. And so we offer that up. And without Kresge, we wouldn't be able to be here. So thank you for your help. The other sponsors for this work, and I have to tell you, I do a lot of fundraising because we're, as a nonprofit, we're always developing resources. And raising money in this environment, I have to say, is hard, and especially when there's so much need right in front of you. But there are organizations that nobody said this was a bad idea. They just said, we're not spending money. Marketing is off the table. You know, foundations are trying to figure out how to be agile with new funding, but it's not online yet. But there are people who step forward and have the vision of it. And Mental Health Services Oversight and Accountability Commission and Toby Ewing, I have to thank you. We've worked together in the past. Karen's worked with them, and we've done work in California around behavioral health and cool stuff that's there, and how that might actually become part of the conversation as we think about that opioid problem that we still have, right? And then, of course, the Michigan Health Information Exchange, who are thought leaders and practitioners in integrated, just great stuff. And they've committed to it, and we'll talk a little bit about the proof of concept that they're helping help us implement on their Fire servers. For the technical geeks, we've held a lot of conversations, let's get technical. And out of that came a proof of concept, which is part of this work, which I'll show you. Our other sponsors, Hive, Data Across Sectors from our Robert Wood Johnson Foundation, MITRE Corporation, and then FEI Services, and folks there who I've known for a long time and have been very instrumental in making the Affordable Care Act and healthcare.gov work. So we're always welcoming new sponsors, but we want to thank the people who are at least allowing us to continue to move forward in this work. And so with that, let me just give you just a couple of points. I think by now you've kind of got the idea. Just to summarize it, what is the national agenda? It's really an initiative that I just described to identify and prioritize structural, systemic changes really needed to dramatically, and I use these words carefully, we're very thoughtful about seismic change, system level change, and to think about upstream the social factors and the health factors with an emphasis on children. How do we get this right going forward? And we do that by emphasizing action and implementation. It's the time to go do. We can stop admiring the problems and figure out the barriers. We know what they are. Let's just go do something. Do something, right? And then leveraging the work that has gone on around interoperability between social care into healthcare and back and forth between education and public health and public safety and work and all these other areas. There's a lot of work there. We have to bring it to bear. We have to show how it's useful now, because the need, as we know, is only going to grow. And we got to build on prior collaborations. The National Academy's report last year was brilliant and really confirmed a lot of the work that's going on here. And I'm glad to say that we're collaborating with them as well as other organizations. Well, being in the Nation, which is affiliated with 100 Million Healthier Lives, and the DASH program. So the nomiker of the NIC is a community of networks. We recognize there are lots of networks out there. We're trying to bring those networks together and those collaborations. So others like HIMSS and NAMD and NESCO and other associations who have a vision, Child Welfare League, how do we bring all those at least to align? And then what we do is we bring our 15 years of doing this work and the recent last couple of years of the NIC to operationalize the programs in 2021. We're going to go do in 2021. So that's the basis of it. Just to summarize, the goal is to, again, radically improve upstream social influences. We're at a moment of time where we actually are living through a paradigm shift. And I don't know what that means. I can hardly say the words, but it's now incumbent upon us to figure it out because it's not going to go away. So we have to figure out how to make some radical changes. And we have the opportunity to potentially change the trajectory of that ocean liner. 1 degree, 2 degrees, just to change it, because it's all broken. Or most of it, a lot of it is broken and needs to be repaired. Second, we're going to use multidisciplinary work groups to identify, assess, prioritize, synthesize the critical things we got to go do. And we're going to vet that in January, and we're going to bring people together, and we're going to have a distillate of a few things across this vast territory that we're going to go do. And your contribution, expertise, passion to make this paradigm shift, figure out what happens next to our safety systems. This is ambitious. This is bold. This is as big as you can get in my mind. And so that's the challenge ahead of us. And we're going to try to bring some fun to it and some visual for those people who hate the written word and would prefer pictures and imagery. We do a lot of work on graphic visualization. We did this for our 12th annual symposium. This was actually the agenda. So from day 1 to day 2, some of you may actually have been there. So we can chart this. So visually, we can now communicate this over the next 6-9 months in 2 or 3 or 4 slides, right? Which we found to be incredibly powerful to share a vision, to share a mission, to share a collaboration. And Anthony Weeks, who is our master artist facilitator, is on board and working with us on this. So I'm delighted to be able to figure out how to bring that to this conversation as well. So not much more said than that. That really brings us to Karen and to David and to PG. And take it away, Karen.
Okay, I won't take up much of your time. This is a really exciting opportunity. We have been having conversations about social determinants of health in the public health realm and increasingly in healthcare for a lot of years. And we actually started a conversation at Stewards of Change and in the Interoperability Collaborative almost exactly a year ago, saying, really tired of just talking about this. What can we do about this? NIC is a very unusual organization or network of networks because it taps so many different sectors, and really addressing those upstream drivers of long-term poor health is going to require multi-sector approaches. And it's very exciting to be focusing explicitly on actions that we can promote and some that we can ourselves take to really make a difference. The pandemic has added an enormous gravitas to the problem. It's not just a cocktail conversation anymore. We are seeing every single day the disproportionately negative impact that this pandemic is having on the same populations who have been suffering negative and disparities in health outcomes. And so this really is the time. There are many conversations going on, but this opportunity with NIC is one that I really think has a good opportunity to create something that looks like actual movement and action. And so that's all I wanted to say. Thank you all for taking time out of your incredibly busy schedules to join this. And I hope each and every one of you will participate to whatever degree you can in actually crafting this action agenda.
Thanks, Karen. And so glad you're on the boat or on the bus. David, welcome. Yeah. The mic is yours.
Thanks. And I'll just echo Karen as well to say, to see 100 people on here taking an hour out of their schedule to start thinking about this, means a lot and is really exciting. And there's a lot of talking today. There's an hour to set up the agenda, set up the framework, and set up the goal. But how we get there, from our perspective, is going to be determined by all 113 of us and hopefully more. And so the reason we're so excited about it. So first of all, I'm co-director of the Center for Population Health Sciences at Stanford. We bring researchers together across Stanford, and our mission is improving population health. And I want to make a comment about that. While we want to focus on doing great research and bringing data sources together for Stanford folks and folks outside of Stanford to do the best research on social determinants of health possible, our mission is actually to improve population health. And that's why I was so excited to work with stewards of change here and with Karen and PG and all of you, because that's not something that Stanford and research is going to do. Research is a small slice of it. We think that's an important part of it. I like to think about, if someone came to me and said, we have $1 billion, we have $500 million, how should we spend this on social determinants of health? Research is going to play some role in that, but it's sort of a lot of actors and a lot of people coming together and thinking, we have this money, what's the best way to spend these resources on social determinants of health to reduce health inequalities? And we are, just to give one example of that, I do work on the earned income tax credit, the effects of that on health equity and population health. And California in 2015, implemented their own state earned income tax credit. It's a great example of how interventions on social determinants of health, reducing poverty, are happening all the time. We have a chance to sort of look at those policies, say, should they be expanded? Should they be done in a different way? Should the money be put elsewhere? What's the best way forward? And, from our perspective as primarily researchers, we want to be part of that conversation. But what we're excited about here and in this partnership is having that conversation with people doing the work, people from a variety of agencies with a variety of perspectives, which I think is really the only way to address that. And I'm really so excited to be working on this together with all of you.
Thank you so much. It's so great to hear. I know that there's other universities on the call and other places, both in California and elsewhere. And so from an academic perspective, we're also trying to bring a lot of voices to the table, because it's a $5 trillion industry, one might say, plus or minus $1 trillion. So the effects of a little change on that size of an industry are profound. So with that, let me turn it over to mon cher PG.
Yeah, and I have a good morning for me. I'm still in the morning, so good morning. Very pleased to be here. I'm based in Canada. The Northern Wall has been closed now since March 21st. So it's always a great pleasure to be talking to you. Daniel sent me an email last night asking me to put a few things in writing, and I woke up very early this morning and I put together a few slides. I think nobody on this call ignored that it's very hard to move from knowledge to action, and it will be particularly tough here because we come from multiple sectors. We are engaged at very different levels, from local to state or provincial level to federal level. We are trying to address very different and diverse problems, but I still think there is a way we could be successful in the end. This is a slide I shown at the last webinar, and I'm working currently with our colleague Uma Aluwalia on a paper that will try to expand the few points on this particular slide. But I would like to concentrate here on point 1 and 4. The first thing that I think we have learned during the pandemic is that good decisions are not enough. If you look anywhere in the world, the vulnerable, the racialized communities have been hit by the virus more than others. And this is not because of race, this is not because of age, this is not directly because of poverty. It's because of the policies that have created inequities, differences of status, of treatment, of housing, and so on and so forth. And I think this is why we have basically engaged in this process, is to make sure that we will in the end address this policy question. And the last point is it has been an incredible lesson in humility. I have said many times, I've seen countries throwing at the virus everything they had and failing. And, just an example this week, 3 or 4 days ago, New Zealand was celebrating 100 days without a case, and it was all over the newspaper. And they have a lockdown now in their major city, Auckland, and that has been expanded and for another 3 or 4 days, a complete confinement of the population. We don't know at this point what to do and what to face in the future. Next slide, please. This is a quote from a now deceased British political philosopher Bernard Crick, but I think it's very important that in terms of our expectation, I don't think we will end this process with a catalog of prescription. If we knew what to do, once again, it will be quite easy. The problem we're facing, as Crick is saying here, is that we will end in the end with settlements, compromises, small ameliorations that will range from the more or less positively agreeable to the more or less tolerable, acceptable. This is what policymaking is always all about. And I think we shouldn't be expecting more than that. But again, this is very much in line with what Daniel said at the start about just if we were able to move the needle a little bit, it will be already an incredible progress coming out from this process. Next slide, please. So what I found always interesting with stewards of change, and the reason I've been a road companion for many, many years, is that we have always in every conference tried to address, and this is a very high level slide, I know, but the idea is that the solutions are not coming only from government. And one of the things that is very important in the message from Steward of Change is that we are always better when we've ended with a policy mix that take into account the possibilities for philanthropy, the market solution for some segment and some of the problems we're trying to solve, the problem that could be solved by people together, by society taking care of itself, the things that, and we have seen that in recent months. I think this is, for my own teaching, this is extraordinary, fantastic. I have now a real example how much protest and conflict could be sometimes indispensable for social change and social movement. And of course, it's very important that we also use public policy and government for the solution of our problem. But again, I'm expecting from that process in the end, solutions that will try to use all those tools together to bring solutions to the problem we're facing. Next slide. So a thing that we have discussed a lot among the leadership for this process is that, what we would really like in the end is that having a vast collection of proposals, solutions that are credible, that are scalable, not only pilots, but things that could actually be replicated and are truly scalable, that are evidence informed, and preferably that have been tested somewhere, and not only projects that are just on paper, so that we could learn from actual experiences. I think it would be great if in those projects, we have an idea of how success has been defined. Maybe it's just me that is frustrated, but I go too often in conferences where I have the impression that the criteria for success have been defined when someone has been able to actually implement one of his preferred or her preferred solution. It is very important in our field, and again, I think everybody knows that to have a sense of what are the preconditions for action in terms of funding, in terms of mobilization of actors, in terms of regulation and legislation, and so on and so forth. And finally, most policies fail. This is something when you have been engaged in policy making for a while. And so it's very important as well to have a sense that we have more than one option to solve problems. I'm saying all this because I think there is a wide range, therefore, of possibilities and solutions that could be put forward during the process, and Daniel will explain how to make those recommendations and bring those solutions forward for the conference. I think I'm done.
That's great.
5 minutes.
You know what? We're actually ahead of schedule, guys.
Absolutely.
So I would ask Karen or David if any of you or PG, if you have a question of any of what you guys just said, to see, to blend that, because I think it's a very cohesive conversation and a good foundation. So, any thoughts?
I mean, I PG is one of my favorite people to hear from, and so I always appreciate his thoughts on what he has to say. I mean, the thing that sticks out for me most is sort of that there will be failures along the way, that this isn't something, in 9 months or 6 months, we're going to say, hey, we figured out this is A, B, and C. So if we set that sort of bar, that's kind of ridiculous. And I think, thinking about the process, thinking about starting on things, thinking about trying things out, and realizing that like most policies fail, a lot of things fail, but in the longer arc, if we're intentional about it and we think through things are going to be better.
Yeah, here. I agree. I think that also the knowing what success looks like when you're starting out, or at least when you've got a kernel of an idea, is critical, because it can keep you on track to, it's very easy to get, because the issues that we'll be dealing with are so intertwined with each other, and with other aspects of life as we know it. It's really important to stay focused if you want to create something that's actionable. And so I love PG's slides.
Yeah. Thank you. PG, any last word?
No, thank you. No, I think I used my 5 minutes.
Okay, good. I'm just cashing out the bank. I knew you put some in the bank last time, so I just want to give it back to you. But thank you for the return of time, sir. So that's great. So I'm so excited to be working with this crowd and a bunch of other people many of whom are on the call, some of them who can't be on the call because they're on other stuff. But there's a coalition, and PG and David and Karen, thank you so much for being part of the sort of the kitchen cabinet, right? Sort of getting this thing off the ground during COVID. So I've been referring to the world sort of as BC and AC now, right? So we're in the AC time, and we're having to go create the future, because none of us have lived through a pandemic before, a global pandemic, and know about it happening real time. So the fact that we actually have Canada and some international perspectives is also critically important, because there's a lot of stuff happening outside of these boundaries that are struggling with as well. So we've invited our colleagues from the European Social Network in. You may have recalled Antonio spoke a couple of months ago. Videos on there, and the work they're doing across all of Europe, Eastern Europe, all sorts of different places is really fascinating and very much in alignment. And they've got some stuff. They got problems too. Not everything's working. So, but there's some lessons learned, and so it's the next hybrid. And so we're thinking about this as what we're creating is really a roadmap for where we think it'll go as we study the impact of COVID on our communities across the world, across the country, across our state, our local, whatever, how we think about that, and what's the roadmap to that makes sense in 6 months, post-election, into 2021, new budget, I don't know, just what do we do then? And so these are the steps that are there. This, by the way, the graphic here, I'll just come back to it because I love graphics. Is some work we did in Connecticut doing some implementation work around integrated systems. And so there's a whole bunch of stuff in here that's the distillation of a year's worth of strategic action planning. And so they can use this kind of thing to communicate, which they did, which is one of the things we can think about, which is how do we tell our story, expand our story, and pictures are great. So they distributed one of these 18-inch pieces to everybody in the organization, as well as had a giant one in their office, but no one's going to offices, so it doesn't really matter. Anyway, so there's 4 steps we're going to be doing. One is we have 7 work groups that I'll show you in a minute. Got to show you the matrix, where we've divided up the world and said we're going to study these things. We've got a proof of concept that we're really proud, because as was reiterated at the beginning, was we're going to go do some stuff. So we've got some places to go do some stuff. And some of those people are on the call today. So thank you, Dr. McCoy. May call on you for a bit later if we get a moment, okay? And then we have our 14th National Symposium. So this is actually, this grew out of our annual symposium. Last year we partnered with San Diego and the CIE to do a collaborative conference with them where we did a bunch of work together. And this year we're reverting to our usual sort of small thought leadership workshop, couple of day event. And we were doing that with Stanford at, I say that definitively, on the campus in March. We'll get there, maybe have hazmat suits, but something. Anyway, that's the goal, either in person or digitally, as well as an interim sort of shorter synthesis conversation in January. And I'll show you that on a timeline. And then we'll be doing some intermittent webinars and outreach, and this will, as PG said, turn into a white paper. And we have some common language through a training course we just published, which if we have time today or the next time, we'll talk a little bit more about it. So we can be on the same agenda here, the same language and vocabulary. So very briefly here, this is the work of the proof of concept called Project Unify. That's an outgrowth of the National Interoperability Collaborative, which is a project of the Stewards of Change Institute, which is funded by Kresge mostly and other folks. So we started in the fall. After about 30 of these webinars, we said, well, let's do something. And Dave Walsh, who's done a lot of work with integrating innovative practices into Medicaid and with MITA, and done a lot of proof of concepts, suggested we actually do something. So we started this do something, and there's a lot to say about that. But what's important about this is a visual of what we're trying to accomplish in many ways. And this is only a partial part of that, because this is what I mentioned Dr. McCoy and the Integrated Care for Kids sites that are been funded recently by the Centers for Medicaid and Medicaid Innovation, put out a bunch of grants trying to connect this stuff on really high-risk kids who are trying to keep them from being removed from their home with the presence of substance use disorder and drugs and alcohol and stuff like that. So connecting, and in a way, this represents what the problem they're trying to solve in this defined community, a couple of zip codes, and the defined population set. And if you think about it, this stuff is complicated, it's three-dimensional. So you can see for yourself the intersecting rings till you either start at or end up always back in the middle with the family and community, what's around people. And so the social determinants overlay on top of this in a sort of a crosscut, which I'll show you. This is the foundation of the proof of concept that's being developed. And that's actually part of the work we'll be doing. That's one of the legs of the stool for this whole initiative as well. And that's part of the go doing that we'll talk more about. Okay, so let me talk a little bit about the work groups. So we want to form a bunch of 7 work groups. Each will identify, it's probably easier to see it, you can identify a few things that really matter to you the most in this one particular area of social determinants. And that will be promoted as a way to figure out what's really important. The work of the work groups will contribute to this documentation that will be used as real-time communication. We'll look at other ways to implement, other places potentially to implement the ideas or the recommendations that may come out of this and cross-cutting sort of interaction. This will actually become, this is the most interesting part, well, one of the most interesting parts to me, which is we're going to create the agenda for the 2021 event together, right? As opposed to us going back and like figuring out the speakers and who's hot and who can we get and fit. We're going to do that together because when, as I said before, when we get there, we'll be there. So the conversation we'll have will be a further synthesis of the ideas that people will do over the next couple of months. And that will convene, as I said, we'll convene that ideally in March in Stanford. We'll see how that goes. Okay, so here's the eye chart for you. I'm just going to talk this through very briefly. This is in a deck we created with David and Leslie Sepp and others from Stanford, helped us sort of get our thinking, which was very broad, into some detailed specificity. So at the top, we got our goal and methods. These are six areas that the Kaiser Family Foundation sort of defines the world of determinants. And there's many different ways that these things are, people think about this, but this one seems to make sense to me and people who've been involved with it. And some of these things are lumped together. You talk about education, you're talking about early education, home visiting, you're talking about P20. You talk to the education people, there's a whole bunch of different people. Same thing on housing and transportation. Anyways, so these are the 6 areas. And now we also added legal services. That's in part because I've learned over the years, it's good to have judges in the decision-making process, especially when you're working with children's issues. But we've had a long opportunity to work with the courts, both in California, the Administrative Office of the Courts, and trying to link together courts and social services. You can't really do social determinants without the courts in many cases. And we recently, Convergence of Factors, after a long time, have started some work with Pew Charitable Trust around looking at court information technology for civil court. And when we first met them, they talked about civil legal work actually as a determinant. And it really resonated for me. And everybody I've spoken to is like, yeah, we really need to think about that in the context of it. So there's a group going on there. There's some duplicate stuff happening. So those are the areas we're asking people. We're going to form teams of, I don't know, my guess, 10 to 15. If there's that many people want to sort of roll up their sleeves, maybe more than that, maybe multiple teams, depending on people who want to be involved. And we'll use a couple of different criteria to sort of lenses to look through each of those determinants. And over the years, we've developed a theory of change and a process for strategic action planning. The stuff I showed you, that map of Connecticut, uses what we call our 10 change drivers, which is the methodology we've developed to work with organizations and jurisdictions to think through this complicated interoperability process. Because you need to think about not only the technology, as folks said earlier, but privacy and funding and performance, all these different things come into play. And so the thought here is, let's look at some lenses. We've developed a rubric against each of these, so you know what's sort of basic and what's advanced. So you can look through that lens. These will be mixed multidisciplinary groups. So there may be an attorney in there may be a privacy person, there may be a technologist, there may be a funding person. You may need to borrow somebody from another group. But these lenses, which this process will be kind of templatized for folks to be able to sort of think about each of these things in the relationship or in context with, it might be housing or transportation. You're gonna have to figure out, that's a complicated one because there's a lot of things to focus on, but there may be some things that go together and that make a lot of sense. And so we'll look at those through that lens. And then across the top, you see this thing that says synthesis and integration layer. That's sort of intended to show, after each of the groups does its work, and they'll be meeting once a month, and then all the groups will meet once a month between September and December or January. Then we'll continue to synthesize the work. And that layer is intended to think about that. And so there's an advisory group, there's people who are doing the work. The process for doing that will continue to evolve, I assure you. And the purpose of the January virtual convening will be to try to distill the work that happens here and get a first cut at what matters the most for all of the different potential categories. I'm going to continue unless there's a burning question. Put it in the chat if you got a question that I need to, that's stopping you from understanding where I'm going. Okay, great. So let me just go to the next one. This is where the getting gets good, or the asking happens. So we've been busy developing a staffing plan, literally, for this. And this represents some of the people who have already said, yeah, I'm on board. I want to participate. I want to participate at these different levels. You can see across the columns are the same, the rows are different. So we've kind of breaking this out into, a lead or a co-lead. Maybe it's equal. Maybe there's a lead or whatever. There's 2 people kind of leading it. There's a whole bunch of team members that include folks from, as I mentioned, the NIC, who've been doing this work for a year. Stanford folks, Integrated Care for Kids, I mentioned, Project Unify, sponsors who are participating. people, other associations, this is the place where people kind of participate. These will be project managed, and there'll be logistical support. We'll have some interns. Actually, another thing that Michigan Health Information, MyHIN, will, what they're helping with, in addition to technology, they've been so generous with offering interns that they mentor, I think it's about 75 or 80 interns every year out of the University of Michigan and stuff. And Josh Rubin, who's on the phone with us, is affiliated with that institution as well, and is participating, knows something about that, and brings Michigan to the table, which is terrific as a partner. Anyway, there'll be support. And then there's an advisory, synthesis advisory group here, which is really about people who, like, you can't get on the calendar for maybe in 4 months. But we want people who are deeply, deeply involved with different pieces of this, from different agencies, different sectors, domains, programs, participate in the synthesis. So that's an area that is being developed as well. And I just didn't want to put another slide in there, but there's a bunch of people. We'll send, as part of the posting of this stuff, we'll share this in an enhanced version of this that shows more details, including more people and more details on roles and stuff. People that really want to get into it. But you can see up here, I want to call out some folks. Those folks who have stepped up in these busy times and said they want to be in the leadership positions. So Uma Alawalia, our board member and a former director of Montgomery County, has stepped forward, and just a wonderful partner to be working in here. And then also Cheryl Austin Kazanoff from MITRE, who is an old friend as well, I might say, and is so enthusiastic about the work that's happening here. And then Shira Patel from MyHIN again is participating as well. So these are some of the folks, our Pew friends, faculty, and then a number of other members that are important just to point out here. Part of this is building the team you want to work with. So Naomi from the San Francisco Fed is very interested. They do a lot of this work. The New England Child Welfare Directors are interested. Bill Kowalski, FEI, is one of our partners. MyHIN. BJ Walker, who just did an amazing webinar on education as a constitutional right, with some very impressive people. And she's agreed to participate in the education along with other people, and maybe bring that webinar. BJ, if you're on the call today, would love to find a way to bring that conversation into the conversation. Dr. McCoy, who's in New Jersey running the Integrated Care for Kids site, and also Michael Beckett, who's the relatively new director of Fairfax County. He's also a Stewards of Change board member, and he's actually piloting our interoperability training program in Fairfax right now. Chris Boone, also another board member. I'm actually getting my board to work hard, you can see. And also Steve Reynolds from FEI. And then the legal side, you can see also, as I said, Lester and his team from Pew, along with Tony Capizzi, who runs a court in Ohio and does a lot of work with information technology, and the Network for Public Health Law with Sally Millam and a couple of other folks there, actually with whom we're actually developing. And part of our curriculum is on privacy and confidentiality that can be maybe almost as a service. So let me just point out, I see a point in the chat here. We divided the world. You can spend a lot of time sort of dividing the world in the social determinant world. And I think the thing that is really important from my vantage point, as we think about that piece I showed you before with the pinwheel, right? So the pinwheel, let me just go back up to that for a second, really defines the three-dimensionality of the work we're trying to do, right? So you could have a bunch of other parts of this. There could be work, disabilities, all these different things. But it's what you do with the information when it comes together, which is the question I've been asking. So, and that's the distinction between what the world calls interoperability and what we're now calling interoptimability. And that's the name of the training course we've got, because what we're saying is there needs to be a special and different approach to using all the information in ways that have never been available before. Like, for instance, I was having a conversation yesterday about the use of telemedicine and how it could affect behavioral health. And actually, are there perhaps some, if not silver linings, some brass linings the fact that the pandemic is here and it's wreaking havoc, there are certainly things we can learn. And the rapid adoption and use of telemedicine is one of those things that I think might be extraordinary, especially as we think about home visiting for not only, think about kids in foster care, think about adults alone, think about disabled people who can't, all those things. If we can create the relationship, maybe there's actually other ways to address even addiction, because of the kind of the personalized medicine that can be provided to people who are shameful around that or feeling full of shame. So the messages are quite profound. So what we're saying is, this is the kind of the grid we're working from, and this again, everything is subject to agile development here. So we've created a site, and this will be in the chat. It's just a Survey Monkey. It's 3 questions, kind of about participating. In what area? You saw the 6 areas. Well, there's like the 6 areas we defined, and so you could sign up, and we're asking, for commitment is about 6 to 8 hours a month, maybe a little bit more. The more you want to read, the more you want to get into it. But there's 2 webinars a month, one for the group, and then one for the cross group work, which we'll be hosting and maybe even doing on the kind of pack them together in the same couple of days. So concentrate our efforts. And as I said, I know so many people are so busy that if you want to participate but can't really commit to a group, and we're really looking for people who are willing to commit to the group, there are lots of other ways to participate, or we'll find other ways to participate in terms of the synthesis or advisory, or on the website, on the hub site. And so that's the plan. I look forward to any questions. I think we've got actually some time. So unmute yourself if you've got a question, or Gillian, do we have some in the chat? I saw a lot of chat. I was not able to follow it. I restricted myself from.
Yes, so we do have some questions.
The first, some folks out. Yeah, go ahead.
The first one's from David. He says, "Thank you. I'm an assistant clinical professor in the Department of Family Medicine, University of Colorado School of Medicine, working on transformational system design, essentially the integration, collective impact of primary care, public health, social human services, and community leaders. Your documents are referring to health, but it is not singular. One key issue is that primary care, being physical, behavioral, oral, is in a very distinct silo from public health, which has its own silo. Successful experience in breaking that down, COVID-19 and non-COVID-19. Did you follow that?
That was a question mark. It was a question mark at the end of that.
Okay.
That's what I was going to say. What the question was, should we define the buckets differently, or?
No, I was just, no. I was just asking, are people running into that issue, and do they have successes in? We're pouring billions into public health suddenly for the first time in decades.
Right.
And yet in order to care for the public and defeat COVID, we need all of these groups working together. And so I just wondered if people have had success with that.
Danielle, if I may.
Please.
Hi, this is Karen. Yes, there have been successes. It is a challenge because though they sound like they would work well together, we actually have very different lenses on health. And in the public health world, we've been struggling to figure out how to engage with the healthcare delivery systems. But there's some very promising models out there, including things like accountable communities for health that very explicitly bring healthcare systems, and most especially primary care, together with communities and with public health as a strong partner. And so that kind of work needs to advance. And in fact, there are currently a lot of efforts as well, trying to further bring the healthcare system into the conversation about upstream determinants of health. There's a lot of work going on in addressing the social influencers of health downstream, and less work going on in part because it's never been entirely clear to the healthcare system what their role is. So I think it's a developing area, but it's a really exciting one. And COVID is bringing public health and healthcare together like never before, because of the need to, yes, you need to care for people with COVID, but we also need to prevent COVID. And the preventing COVID part is largely landing in the public health sector, appropriately enough, because it's a population kind of an issue. So I think there are lots and lots of opportunities for that, and some good models out there.
Thank you.
Any more thoughts or questions, Gillian?
Yes, there is a comment. Very happy to see legal services included there, so much that destabilizes a family's housing, financial well-being, health, etc., can be prevented with early legal intervention. So that's just a comment. There is an additional question. Thinking a few things should be added in a neighborhood and physical environment. I think we should be explicit about clean air and water.
Yeah.
I would add extended learning opportunities, such as summer learning loss, out of school time activities to education. Lastly, where do issues regarding immigration go? Is that legal, community, social context?
Great questions. Great questions. Yeah, that's the work. That's the work, right? I mean, how do you take everything and say, these are the 3 to 5 things that really will matter most over the next couple of years, and then but they're implementable. So, so that should be the fun, is to kind of wrestle that. So Christine, I want to just say, if you got a second, introduce you. Christine is one of the Inc. awardees, and is also an intended member of the National Interoperability Collaborative. And she's our partner with developing the proof of concept, Project Unify, to see if we can just hold up a mirror to her initiative to say, look here first, and let us help you sort of connect the unconnectable or the unconnected, let me say. And so welcome, and just a few words to say hello, introduce yourself, because I'm so excited about being able to bring this knowledge burning right through into New Jersey. Gotta unmute.
Be muted. All right, is that better?
Yeah, I got it.
All right, very good. So thank you, Daniel. Really exciting to be part of this group, and really looking forward to having our project here in New Jersey get a lot of extra special attention, which it certainly needs. As Daniel mentioned earlier, that it might have kind of flown a little bit under the radar. What I think that is so special about this Integrated Care for Kids project is that while it is funded and sponsored by CMMI, its main outcome is preventing children from being placed outside of their home. And so you can just see from the very beginning the really societal perspective that this project has, if it is successful in achieving that, the main savings is not going to be to the healthcare sector, which is sponsoring it, which I think is pretty unique. And I'm actually concurrently attending the CIE Summit in San Diego right now, and a lot of the discussion there has been centered around, how do we have these projects that are not just about saving dollars, that really are about really improving people's quality of life. We're very excited. We are about a little over 6 months into a 7-year project. Thank you, CMMI, for actually giving us time to accomplish something. And 2 years of planning, and then a clinical launch in early 22, along with 7 other sites around the country who we hope we will bring in we'll bring into this project as well. But again, there's so much to do, and although the project is focused on children, that of course means that it's focused on families, and so I think it's very, very broad in scope.
Thanks very much. Cool. So there's so much to be said, and so much has been unsaid so far. The question of racial equity and everything around us must, it's front and center. And three white faces on the front of this, very aware of that. But I want to just be able to speak about this just for a second. As you look at the people who are involved in the work and have committed to it on that chart, you'll see many people of color and many people who've accomplished in many areas. And so while I have to be always aware of it and constantly reminded of it, the conversation, we have to have the conversation. I may not be the most skilled person to have that conversation, but within the white community, I'm fully, I attest to having to have the conversation with other white people in a way, and then approach people of color with some maturity, more maturity for some of us. And so I don't know how to do that necessarily, except trying and getting embarrassed and getting angry maybe and whatever. And I just have to invite everybody into that conversation. And it's easy to say that. We have some guides along with us who can help, and people who know people who can come and help to have that conversation. And people actually importantly participating in that grid. And I apologize for not having actual call out for people who have lived experience. So bringing people in who are actually living is always a reminder in all of these events. And as we do a adequately mediocre job of fulfilling on that, but it's hard. And it's hard not to be tokenistic as well. And so that balance of that is important to think about, but committing to it is hugely important. So with that, I just have one more thing I want to mention because this is also really cool. Thank you for reminding me that. By the way, this recording will be posted. The chat notes and the URLs will be noted. You'll see actually in the, if you didn't get the link for the sign up, it'll be on the website. We'll send, you'll get it. You should be able to find it. But on the 28th, we're actually kicking off the project to look at courts and how do we improve civil legal court, which is gigantic. And just think of all those tens of millions of people who have these healthcare claims or getting kicked out of their houses or foreclosing on loans. It's like unbelievable. So we have the good fortune of the timing of this is fantastic because it only took a year to, I say this with all due respect and love. Some organizations take longer to contract with, but it was during COVID. So anyways, we've just launched the project with Pew Charitable Trust. We're delighted about participating. This is the precursor. This is exciting for folks as well. And this is a precursor for a multi-state implementation proof of concept that they are talking about. We've been talking about. That is in part of the strategic planning for the following years. So this sets the plan. It informs that plan about what would matter most in the courts. If you could provide, automation to people who need legal help, who have access to none of it. I just lost my slide. Oh, there we go. So anyway, you can sign up for that. If you haven't signed up for the NIC, nic-us.org, and it's also in the chat. Just sign up and you'll get on the mailing list. So you'll hopefully get our stuff. You may have to pull it out of your junk mail or spam, but we do send out. We're trying to do one mailing a week and a reminder or something, so not to overwhelm people's inbox too much. And with that, I want to say thank you and have a great weekend. And I'm looking forward to working with all of you going forward. Have a good day. Ciao.
Thank you, everyone.